hope you will agree with me that we are done with May 2021 paper 1 past question. Now it is the time of May 2021 paper 2 question. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about paper 2 2021 May past question. We are going to be analyzing it in depth, question 1, question 2, and also question 3. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be discussing May 2021 paper 2 past question. For those that have not watched the way we analyzed paper 1 past question, all you have to do is to watch the video in the description box below so you get an info on how to tackle question, especially those that were stranded in the exam hall. They were confused about a particular question in regards to paper 1. So the video is definitely going to help you. So now let's analyze the paper 2 question 1, paper 2 question 1. Thank you. Alright, it says that Mrs. Asabe, a 35-year-old housewife, is admitted into the female medical ward with complaints of periorbital edema, swelling, pedal edema, and dyspnea on exertion. A diagnosis of right-sided heart failure is made. You can see the question now. There's edema everywhere. That's fluid is gathering everywhere. Periorbital edema and also pedal edema is present. And also there's dyspnea, which is difficulty with breathing. That's already giving you a clue on what to write, on what to tackle when carrying out your nursing management. The question 1 says, with the aid of a well-large labeled diagram, describe the interior of the human heart. Yes, I've seen a lot of students coming up to me, Nurse Miss Mary, they are saying we should describe the interior of the human heart. Are we to describe the full heart? As stated, describe the interior of the human heart. That's the inside, the endocardium of the human heart. That's what they want you to describe, the innermost layer of the human heart. Before I go into details, when they ask you to draw, I'm repeating this again, occupy the full page, if possible the full first page. At least half of that full scar should be occupied with your diagram, because they even said it, large diagram. So to get your 1 mark, please draw your large diagram. So they are telling you to describe the interior of the heart. What is the interior of the heart? The interior of the heart is the endocardium, and the endocardium is what? The innermost layer of the heart. What you have to do is to tell us what the interior components of the heart is made up of. You know, the innermost layer of the heart is made up of the right and the left side, where we have the atrium. We also have the ventricle. We have the upper and the lower chambers. We have the right atrium, the left atrium, the right ventricle, your right ventricle. You talk about that. Then you talk about the valves that are present. The atrioventricular valve, that's your tricuspid and bicuspid valve, which are also known as the right atrioventricular valve and the left atrioventricular valve. That is also important when discussing. Don't waste your points. Outline these points. Beginning, okay, the interior layer aspect of the heart has 2 parts, the left and the right, which is separated by a septum. Go to the next part. Say another point. I will always tell you, don't make your work clumsy. Don't write as if you are writing summary. Outline the description, outline the points, so that your examiner will get joy when giving you your mark. In terms of description, it's 3 marks. If you are able to give 6, they just need 6 good description, 6 good things about the interior layer of the heart, you will get your complete 3 marks. Nobody's going to steal it from you. Even if you didn't drop your blood supply, your venous drainage, your nerve supply, you are going to get your mark completely. Just give us 6 points that is correct. 6 points that you know, okay, it's like it is the innermost layer of the heart. So don't need to start adding jara or something. Do you get? So that's what you should take note of. For those that don't really know in details the description of the heart, there is a video on the description of the heart, and we also have some voice notes on our Telegram that explain the heart proper. So that is that. Then the second question says, state the immediate nursing and medical management. The immediate nursing and medical management within 24 hours. If it was cardiac arrest, please take notes, because one of my students almost made a mistake between cardiac arrest and heart failure. If it was cardiac arrest, where you have to do your CPR, that is the immediate management. This one they are telling you within 24 hours of admission. That means this patient, Mrs. Asabe, is in the ward, is already in the ward, having these signs and symptoms. So you can apply what? Apodesera. Do you get? See, for those that don't know what apodesera is, there's a video that explains how to write nursing management. So apodesera fits perfectly well for this question, since they said nursing management. So you assess, position the patient. And I will always tell my students, when it comes to cardiovascular disease, respiratory disease, the best position to put your patient is in a semi-Fowler's position. You put your patient where? In a semi-Fowler's position. So when you apply apodesera, you will be able to get the nursing management for these patients, and you get your marks complete. Do you get? You don't need to crack your head. Then the other one says medical management. Yeah, medical management too. In terms of medical management, like I always tell you, medical management is not just about drugs or pharmacology. Medical management has to do with the tests, laboratory investigations that are carried out. You get? Your chest x-ray can be carried out to find out, okay, what's wrong. So any laboratory investigation, any blood test that they have to carry out falls under the laboratory investigation, and also falls under what? The medical management. And in terms of pharmacology, the drugs that to be used, we have your angiotensin converting enzyme. Angiotensin converting enzyme inhibitors there. Angiotensin converting enzyme such as your pril, your lisinopril, I think I have some here, captopril and lisinopril. Yeah, I wrote it down so I don't forget and I don't leave it. Then also we have the beta blockers. Your beta blockers include your LOL, lafatlag, propanolol, acetabunolol, labetalol. Those are also drugs used for right-sided heart failure. Then we have your diuretics. Yeah, remember there's edema, so we need to take that diuretic so that to reduce the edema and the fluid will go out. Then we have vasodilators that will help us to dilate the blood vessels. So these are some of the medical management for what? For right-sided heart failure. Then also the last question says, list 4 complications she may likely develop from right-sided heart failure. Complications, that's the turnout, the prognosis, the dangers that is likely going to happen. So some of the complications, there may be adrenal, there may be atrial fibrillations, there may be kidney damage. If care is not taken, the function of the kidney will be impaired. There may be liver damage. It can also come as a result of what they call it now? As a result of right-sided heart failure. It can lead to heart attack. Yes, if you are having this right-sided heart failure, it can lead to heart attack. It can lead to cardiac arrest. It can affect the function of the heart generally, and it can affect the full function of the body if care is not taken. So that is that for the question 1. Remember, make your diagram as big as you can. Your diagram is 1 mark. It doesn't have to be very, very fine, but just draw something that shows, okay, this is the right ventricle, left ventricle, this is the valve. Draw something. It's 1 mark, so don't kill yourself for those that don't know how to draw like me. Labeling is 2 mark. Generally, most times, if you can give 4 correct points, you get your 2 marks, but you can actually give more than 4 if you know it. Then description, like I earlier said, is 3 marks. Then in terms of this nursing and medical management, it's usually 9 marks. 3 mark. Apodesera, you've gotten it. I've told you, nursing council is easy. Then we'll talk about complications. They said we should what? Enumerate 4 complications. You can give 8. Then the other one, oh, sorry, there's a question I did not answer. It says enumerate 8 advice you would give to Mrs. Asaba on discharge. 8 advice you would give to her. Remember, I talked in when I was talking about nursing management, I also talk about how to write advice on discharge. You have to tell this patient to be carrying exercise that he or she will be able to carry out. You have to tell the patient to eat good food, like more vegetables now instead of fatty food. They should reduce the intake of fatty food, reduce the intake of alcohol. You have to take the patient to come for follow-up care. You have to take the patient to take the medication as prescribed. You have to tell this patient when they notice any abnormal changes, they should report to the facility as soon as possible. You have to tell this patient to practice both environmental and personal hygiene. So these are examples of advice on discharge you can give to the patient when it comes to what right-sided heart failure and also other disease condition. So for those that have been following up with our videos, you will notice that question 2 and question 3 have been answered without you knowing. Let me tell you. Alright, I think question 2 was talking about female genital mutilation. Female genital mutilation. So all the questions there were answered in our female genital mutilation video. So to get answers to question 2, just watch our video on female genital mutilation. While also question 3 was talking about electroconvulsive therapy. To get the answers to question 3, you have to watch our video on electroconvulsive therapy, because that's basically what question 3 is talking about. So you can see question 1, question 2, question 3 answered with ease. Hope this video helped you understand how to answer questions stylishly, and also hope you understand the answers to those questions that were given on that particular day. Thank you very much for staying tuned. Thank you very much for watching our video. I really do appreciate. Thank you all our subscribers. I really do appreciate that. Please and please, let's try as much as possible to click on that like button. Just like my video, like, please like. Then also just drop a comment. Just drop a comment, please. Drop a comment below. And also share with a friend, especially a colleague and also a nursing student. See you in our next video. Bye.